Hi, I'm Dr. Mike Datola, and I'd like to welcome you to this episode of Inside Dentistry's Product Talk. We are on location in Des Moines, Iowa, in the office of Dr. Bob Margis. Bob is an adjunct professor in operative dentistry at the University of Iowa School of Dentistry. He's also an Inside Dentistry board member, and beyond that, he's the editor-in-chief of Inside Dentistry magazine. And we're here today to talk to him about GC's Equia Forte HT. Bob, thanks so much for having us in your office today. I appreciate being here.
Welcome. Happy to have you.
You know, when you think of glass ionomers, I think of GC. They've been the market leader in here for decades. Was that kind of your introduction to glass ionomers as well?
Yeah, I remember using the Simmons Miracle Mix at the time. We had to mix a little bottle of amalgam.
Oh, Miracle Mix, blast from the past.
Absolutely. It was one of the better materials for buildups.
Well, today we're here to talk about Equia Forte HT, and it's not just a glass ionomer, it's a glass hybrid material. And I think this is an important distinction because a lot of the dentists that I talk to seem to feel like glass ionomer is more of a temporary type material, but the Equia Forte HT is definitely a long-term restoration. Tell me about some of your favorite uses for this material.
You know, I like it for like root caries. I like it for pediatric patients. I use it for even simple occlusals. Anywhere I need even a little bit more fluoride release.
You know, it can be an excellent amalgam or composite replacement material, especially in high-risk patients, so somebody who's got a high caries index, or geriatric patients who maybe have xerostomia or they're taking a ton of meds that might lead to that, or pediatric patients. And we've all seen the research, I think, on how the average composite restoration lasts 5 to 7 years, and it's even shorter in some of these high-risk patient classes. Tell me how about you feel about using a glass hybrid material for some of these high-risk patients.
Yeah, I think it really is the best material, especially if I don't have enamel to bond to. When I don't have enamel, if I'm bonding to cementum or I'm bonding to root structure, and you know, even in the pediatric patient, I find it to be a very nice material, and I've been using it now for several months, and I am enjoying working with it.
Excellent. Well, the Equia Forte HT is a glass hybrid because of the mix of fluoroaluminosilicate particles that are in it. And you've got some larger particles and then some highly reactive fine glass particles. It's really an intelligent recipe of distribution and concentration in here. And really the whole point of all this is to have a material that handles better perhaps than materials in the past. How has the material been handling for you when you're placing it?
Yeah, I've used these type of restoratives in the past, and I will tell you that some of the problems I had with previous versions have been like pullback. They were a little bit too opaque. Not the handling wasn't very good. And so I've been pleasantly surprised using this material for the last several months with the handling, the translucency, and I'm impressed with what they say about the fluoride release.
Yeah, and so the stickiness was always kind of an issue. You would kind of get it where you wanted it and then start to manipulate it with an instrument, maybe as a buildup material or something else, and it would kind of stick to the instrument, and it could be very, very frustrating. So the original Equia was introduced in 2009, and then in 2014 they introduced the Equia Forte, and it had higher compressive and flexural strengths. But they realized, upon feedback from some of the dentists, that it had lost some of the translucency that it had before, but it was a good trade-off for a material that performed better. So now in 2019, we have the Equia Forte HT, where the HT stands for
high translucency.
High translucency. So how important is translucency to you for like a direct restorative material?
You know, in the past, I've sacrificed aesthetics for the benefits of these restorative materials, but now you have the best of both worlds with the compression strength, fluoride release, and the high translucency. It makes a big difference. I've been much happier with the aesthetics of this.
You know, in a recent issue of his CR newsletter, Dr. Gordon Christensen was talking about the crisis, that was his word, of recurrent decay at the base of a proximal box on a Class II direct resin restoration. And he did a survey of his readers, and 43% of them said that they see recurrent decay at the base of these proximal boxes on a regular basis. And because the Equia Forte HT is so good at releasing, as you said, fluoride at the tooth restoration interface, how important is it to you to have that kind of fluoride release in a direct Class II restoration?
Yeah, I think it's very important. And the thing I liked the best about it was when you're doing a sandwich technique in the past, a lot of times you would inject the material into the box, and a lot of times you'd be trying to condense it and it would pull off. What I find now is it's easy to place, let it set, and then come back and do like an open sandwich technique with a composite resin restoration. Now, that being said, if you have a smaller restoration, you could do the whole thing now with this material and have the compression strength and have the aesthetics go along with it.
And I heard you mention earlier that if you don't have enamel present, that's when you like to have it. So I'm guessing if you're dropping a deeper Class 2 proximal box and there's no enamel, you definitely want some Equiaforte HT down there for that fluoride release and for that seal at that margin.
Absolutely.
Well, you were nice enough to share a couple cases with us. Let's go ahead and take a look. Tell me about this first one.
Yeah, this patient came in, I don't know if the restoration had fallen out, but there was some recurrent decay in this tooth.
It looked like, that definitely looks like it's been prepped by a
Yes,
dentist, right?
it does.
So I'm guessing it fell out. So maybe it was a resin or something along those lines for that Class 5. You already said you like this type of material for these types of restorations.
Yeah, so what I did is I packed some cord and I removed the decay.
Okay.
And then I'm going to condition the tooth for 10 seconds.
With the cavity conditioner?
Cavity conditioner,
Okay.
rinse it off. Don't dry the tooth, keep it a little bit moist. You maybe ought to take a cotton pellet or pledge it to remove that excess moisture.
Yeah, you definitely see better bond strength of the Forte HT to moist dentin than as opposed to something that's been desiccated.
Yes.
And so we're leaving it moist here?
Yep.
Okay.
And then I'm going to take the material, I'm going to inject it out of the mixing tip, and this is triturated for about 10 seconds. And normally when I put this on, I would get pullback.
Right.
And what I find with this material, it's a much better handling material. I'm not having it stick to my instrument, and as I'm going, I would always have to overbuild the restorations much more because as
Right.
I was packing it, trying to get it perfect, I pulled the instrument off and it would pull off. Here I can kind of give it some shape to it and save me time in finishing.
Well, that's a really good test, too, to see if a material is truly non-sticky, because it's not like a deep Class 1 where it's got tons of retention. These are kind of non-retentive preparations, these Class 5. So if you can manipulate that with a Class 5 instrument and not have the material pull out, you know that it's really not a sticky material.
Yes.
So you place it and kind of do your gross shaping, and then how long do you wait? When does it set?
I wait for about 2.5 minutes.
Okay.
And you can see here, I'm really not having a lot of excess around the gum because I was actually able to take that instrument and go down with that thin IPC
Yeah.
titanium coated and not have to really irritate the tissue at all.
Yeah, it looks good. Maybe just slightly over contoured
Yes,
a little. So
yes.
you're going to go in, and how are you going to finish it at this point?
I'm going to finish it with some carbides,
Okay.
and then maybe a disc.
Okay.
And I'm not going to polish it. I'm just going to. That's going to be my initial finish.
Yeah, this is not a material that has to be polished because of this step.
Yep, works very well.
Right.
Able to place that on.
You were showing me it's got that new cool little
Yeah.
ergonomic lid on it that you can flick open like
Absolutely.
that. And you mentioned that you don't waste as much either because of the shape and how that works. So the Equia coat goes on. As you said, you don't have to polish underneath it. It reminds me of how in a dental laboratory, restorations don't have to be polished before because they get glazed. And this is essentially, in a
glaze.
sense, the same
Yes.
thing that we're doing here. So what do you do after you place the coat?
And then that's it. Take the cord out, and I'm done.
Okay.
You know, I light cured the coat
Sure.
for about 10, 15 seconds, and I take the cord out, and this is immediate post-op. I
Right.
mean, normally I may have more finishing to do because of the material having slumping, and I'd have to use a burr and go around the gum more. This was pretty simple to do.
And I always like to think of the Equia coat as kind of a clear coat of armor on the outside of it that helps, seal and improve the restoration. And when it has the coat on the outside of it, I feel like the Equia Forte HT is going to last as long or outlast composite. I feel it's that strong of a restoration when it's in place like that. Let's look at this second case. What's going on here?
Here I just prepped the tooth, and I had to remove the amalgam, remove the decay, and I like to build up the teeth, and I chose to use the Equia Forte HT for this. And basically I'm just going to condition the tooth for 10 seconds, rinse it, and then I'm going to keep it slightly moist, and I'm going to inject the material. And the thing about this for the buildup, normally when I was doing a buildup, if I put it in the tooth and I'm trying to pack it and stuff, it initially wanted to slump or pull
Right.
back. The material handles much better than the older versions of this type of material. And so I find that It was easy for me now just to go back and just slightly prep around the margins.
That's
and
great. It's
clean it
almost
up.
not enough to be non-sticky. You still have to be able to resist slump and not just
Absolutely.
be a pushover when it comes. By the way, every dentist who's viewing this, please, on behalf of all dental laboratories, build up your crowns like this. Technicians try much harder when they see crowns like this. So you've done kind of your shaping, and now you're just going to go in. Oh, look how nice that looks.
Yeah, go ahead and
In
prep
fact,
it.
that's indistinguishable from composite resin.
Correct.
Except you've now got a buildup in here that's going to release a ton more fluoride than a composite
Correct.
resin would. That's perfect. So at this point, you just pull the cord, take the
Pull the cord,
impression.
make the impression, and he's got nice compression strength, fluoride release.
Oh, yeah.
A lot of good benefits.
You don't have to worry about that. How is it prepping it as you're going in with the
You know,
tooth?
it preps nicely. It's a little bit softer than Denton.
Sure,
but,
as you would expect.
But it's a very nice material.
Excellent. And on this last case, that looks like I haven't seen a primary molar in a while, but that looks like a primary molar.
That had deep decay. Patient had pain on it, so we were going to have to do a pulpotomy on this too.
Okay. And it looks like that's exactly what you've done here.
That's exactly right. Instead of doing, there's a lot of good tooth structure there. I didn't want
Right.
to put a stainless steel crown on, and I've used these type of materials, similar materials in the past, but I feel much more confident with the ability to have the compression strength that these aren't going to break out.
Right.
And you know, this isn't meant to obviously be put over a pulp
Right.
or a pulpotomy, so I've used material over this prior to placing the Equiforte HT.
Right, so yeah, so the Equiforte HT is not a material that should be used for pulp capping. So you put that layer on there, and it looks like you've got it
Yep.
here, then you've got your matrix band in place. And by the way, I think every mother is going to be happy that you're not putting a stainless steel crown on here as well. I can't believe they'd be happy. So once you have that on, what's your next step is going to be to use the cavity conditioner again?
Once again for 10 seconds, rinse it,
Okay.
keep it slightly moist, and then triturate for 10 seconds
Mm-hmm.
and inject the material right into the cavity prep. And I'm able to actually kind of manipulate this and form and shape it, so I'm not going to have as much finishing to do as in the past.
Right.
which
And
is much
again, it's
nicer.
nice that it's a true bulk fill. So, I mean, this is a primary molar. But if it was a permanent one, you're not having to worry about layers and how much you can cure through. You can fill something 6, 8, 10 millimeters deep
Yes.
because of its self-cure properties.
This
Well, that's
is-
looking pretty good already.
Yeah, you know, very little finishing. Now I'll just take either a carbide or a diamond and just kind of contour what I want.
Okay. There's with the matrix band out.
Yep, and non-polished.
Okay.
And then I'll take the Equia coat.
Okay. And again, you put that on, and then it gets a 10-second cure, did you
Yep.
say? Okay. And wow,
It's a nice restoration.
that looks great.
Yeah, the patient was happy. I was very happy with it, and I believe that restoration will last as long as it needs to.
Right.
I think the patient will exfoliate that tooth with the restoration in there, and I do like the fact that it has the fluoride release, as we said in the past, with good strength.
And we've seen the kind of decay that this patient is capable of developing in an area like that. So it's nice to have something that's going to release as much fluoride as that restoration does. And I have to think mom's happy when she looks in there and sees that instead of that big shiny metal tooth.
And the other thing is, you know, the cost. The cost is much less destructive to use a stainless steel crown, and the restoration is going to last a long time.
My dad was a dentist. I remember saying to him once, I think stainless steel crowns are hard to do. And he said, only the first 1,000. And then it gets easy. So I think, though, not only are you providing something that's easier, more economical for the patient, and something that looks better, but just a better restoration in general with a better material. Well,
I agree
Bob,
with that.
Thank you so much for
You bet.
sharing those cases.
Thank
Really
you.
appreciate it. Well, that'll wrap it up for this episode of Product Talk. We want to thank Dr. Margis for inviting us into his office. So on behalf of Bob, myself, and all of us here at Inside Dentistry, I want to thank you for your time and your continued commitment to quality dentistry.